host, DJ Kei-Touch.
Welcome to the outlet with Kei-Touch. Oh, I'm just so excited today to have my first guest, who is also my best friend from recent times, Alexis J. Williams. Now listen to this title: Advanced Practice Registered Nurse, Psychiatry, Mental Health Nurse, Board Certified. I mean, she's official. So, Alexis, welcome to the outlet with Kei-Touch.
Thank you. Thank you so much for having me on today. You know, it's always good to catch up with an old friend, and I'm so happy and so honored to be able to speak with you today.
Yes, and I mean, it's so cool that you really are a professional, because all I have here on the outlet with Kei-Touch are professional opinions. Everyone has an opinion and everyone is entitled to it, right? But it's nothing like a professional opinion from an advanced practice registered nurse in psychiatry, mental health, nurse board certified. That's a lot of in your title, Alexis. I love it though.
Thank you.
But Alexis, I thought it was important to bring you on to discuss mental health. Someone we knew passed away on the 1st of January. I had 2 cousins pass away in January. Congress, people are stressed about the political climate. They have so many natural disasters going on. We see planes falling out the sky and all this stuff going on. And it's just a little stressful right now. So I wanted to bring you on to kind of share a lot with us today, especially when we're talking about coping mechanisms, when to get help, certain symptoms we can see in some of our friends and family, things like that. Because as you know, in the Black community, it's kind of been a negative stigma when it comes to mental health. You always hear, "Oh, you're gonna be okay. Life is too hard. You can't have no problems." You know, so
Pray it's gonna be
pray
okay.
about it. It's gonna be okay. I want to start with your thoughts on mental health challenges post-COVID. Have you seen the increase of mental health challenges post-COVID?
Yeah, absolutely. Since COVID, 2020, so the last 5 years, and counting, because every now and then we get a spike in COVID numbers, right? And then we also have down south, we're dealing with measles outbreak as well. So absolutely, since COVID, there has been way more people seeking mental health treatment, just due to whether it's their own kind of psychological stress they're experiencing from having to work at home, from having family members who, was hospitalized or who succumbed to the COVID or the COVID disease when they were in the hospital. You can visit your family members, to, children passing away, grandparents passing away, the fear of traveling, the fear of being in public. So then you have people dealing with isolation, right, at home. Just so many different facets. COVID affected so many different facets in each, in everyone's lives, where it definitely left a lasting impact, and leading people to search and to seek mental health treatment.
Yeah, so, and I've noticed even with my personal providers, those appointments aren't available for therapy like that. It's like
Yeah,
it's insane. It's like,
yeah,
well, what are people are supposed to do? And that's why I wanted to talk to you about coping, because as you know, as a advanced practice registered nurse, psychiatry, mental health nurse, board certified, as you know, that there are a lot of people seeking treatment now, and the demand is higher than the supply right now.
yeah. Absolutely, absolutely. During COVID, they did kind of loosen up on some of the laws. We had a lot of new practices that opened up that allowed people to, do virtual appointments. But since then, as of late, they have kind of pulled back on some of that now that they are requiring patients. Not everyone, not all, but some of the insurance companies are requiring patients to go back into the office. And then they kind of looked at some laws with the virtual appointments that have kind of decreased the amount of providers that's available and the availability for telemedicine or telehealth appointments. So that has limited some of the availability for patients to seek those mental health treatment appointments. So it has made it a little difficult, but still with that, I do, I can't stress enough how important it is to reach out and get that professional help. If you're noticing, some symptoms of depression, anxiety, isolation, suicidal thoughts, for sure. So definitely there has been, some difficulty and some challenges with getting appointments, but I still say don't stop fighting, don't stop trying, don't stop reaching out. Make sure you're reaching out to get that help that you need.
Great advice. And you're just saying, do not give up. Do not give up. If you are struggling with something, keep reaching out. And that's unfortunate to hear that the insurance providers are forcing people to go in, because some people may live in rural areas. As you know, with the federal government, everyone is going back into the office. So if you have an appointment, you're probably going to have to take a whole day off versus because you can't telework. So that's kind of a challenge in itself. So I guess my advice would be to seek telehealth if possible.
Absolutely.
If you're unavailable to go in. Briefly, tell us a little bit about that long title I read out and what that means for those of us who are not that informed about all the titles that go along with advanced practice registered nurse and the specialties that go along.
I feel like you like saying that.
Can I say it again? I want to say it again. Advanced practice registered nurse, psychiatry, mental health nurse, board certified. Yes, ma'am.
So advanced practice registered nurse, we are, it's a step above a registered nurse. So meaning I have gone to school and I have been prepared at a minimum of a master's level in nursing. So what separates us from a registered nurse, be it that I am an advanced practice registered nurse, is that I now can assess patients. I can diagnose patients, and I can also treat patients with pharmacological treatment options versus a registered nurse who, work at hospitals. They can do a nursing assessment, but they have to give that information to a physician so that the physician can make a diagnosis or make a determination of what the patient needs next. So I will be doing that assessment. I would be making a diagnosis, and I would be providing the treatment or writing the medications that the patient needs. In my situation, my case, I am a mental health nurse practitioner. So I focus my care on patients needing mental health treatment versus someone who may go in for cardiac issues or someone who may go in for GI issues. And board certified is meaning I've met the standard set aside by ANCC, which is a certifying body that says I meet the criteria to practice as an advanced practice nurse.
Wow. Well, I just want to say thank you for your service. I mean,
Absolutely.
Both of them. Because you are an officer. I'm just so proud of you, Alexis. You're an officer in the Navy Reserves, and you actually helped out a lot with COVID in New York City when that was going on with the Navy, and that you are a nurse. And it's unfortunate, but it took COVID for people to really value those in the health profession fields,
right?
Because we just saw, because during COVID, you guys didn't get a break. Your field was not at home. You were saving lives. You were saving lives. Wow. Share with us briefly about some of your experience that you want to share when you were in New York during COVID.
Yeah. Well, funny. When we went, that was probably the quickest kind of mass deployment that the military has done in quite some time. I think I got a notice a week out the door. There were hundreds of us headed to New York. So it was a pretty quick turnaround. I remember when I got the phone call, I was at my mom's house, standing in her living room, and then one of the chiefs called me and said, Lieutenant Commander, you might want to take a seat. And I was like, okay, what's up? She's like, your name, you've been tagged. You're going to New York. And I, that was early on when COVID was really a death sentence. If you got it, you were dying, right? And so now I am going to New York, where everything you're seeing is the hospitals are overflowing, people, dying on the street. Times Square was shut down. It was just so much going on. But early on, nobody really knew what to do. Nobody knew the treatment. And so it was a death sentence then. And so when she told me I was going, I was like, oh my God. So I sent a text out, to close family and friends, like, hey, y'all check on my mom because I'm going to be gone. She was crying and upset. But once we hit the ground there in New York, the funny part I was going to say is that they put me and a psychiatrist on duty to assess patients, right, with COVID, and we were the only ones on duty. And so I was just like, I don't treat coughs and colds and sneezes. God knows I don't treat COVID. I don't know. And the psychiatrist was worse than me. I'm thinking I'm going to be taking care of mental health needs, but they put the two of us on duty to take care of COVID patients. So, eventually I made it to our wellness center to take care of the troops, which was a more appropriate fit. But it was hard work altogether.
Oh my goodness. We're going to take a quick break. Look, I'm here with Alexis Williams in her long title. Look, she is an advanced practice registered nurse, psychiatry, mental health nurse practitioner, board certified. So she is official here on the Outlet with Kei-Touch. On the other side, we're going to get into some signs and symptoms you should look for, especially when someone may be suicidal. It's Outlet with Kei-Touch. Stay with us.
DJ Kei-Touch.
Welcome back to the Outlet with Kei-Touch. Yes, I'm just so excited to have this special guest on with me, someone I've known since middle school. Wow. We go way back, girl, way back. And I have to be honest, you need to really take time. I mean, I know we have fun with friends, but when Alexis and I talked first about this, I was just so impressed and amazed at all the work she's doing. I know, shout out to Mrs. Williams, her mother. She was a nurse, and I'm just curious. I remember your brother, Alex Williams III. I don't know his middle initial, but I know he
J.
went to J too. Oh my goodness. They didn't really, y'all should have been twins. Y'all were almost twins.
Almost.
But he went to the High School of Health Professions. So I was just curious, what led you into nursing? I know your mother had some influence on that, seeing her work all those years in nursing, and she may still be doing it.
She is, bless her. She's 73 years old and she is still working as a nurse. She's in management, but she's working as a nurse. And she also, she instructs students, nursing students. She's a clinical instructor at Prairie View. So she's still working hard at 73 years old. But
awesome.
definitely my mom, healthcare nurse. I watched her. I spent, some of my years younger at the hospital while she was working. Because, back in the day, the men, they worked. The women had to figure out what they were going to do with the kids, when they were at work. So sometimes we would go to work with my mom. And, as a kid, I helped out where I could. I couldn't do much, but I did what I could. My grandmother was also in healthcare as well.
Really?
Funny, although I did follow my mom's footsteps, she kind of almost tried to talk me out of being a nurse early on because she felt like nurses didn't get the respect that they deserved. Nurses worked really hard. When she was coming up in her young nursing career, being a person of color, they definitely didn't get the respect. They didn't get the pay. You kind of did the jobs that the other nurses didn't want to do, right? And so she felt like it was tough, but she's proud that I am a nurse. And I think overall she's happy. I mean, nursing has come a very long way. So she's happy that I'm a nurse now as well.
I'm happy you are too, because you are really out there changing lives, helping people. Tell us what led you into focusing on mental health and where you actually started when you first graduated from college with your bachelor's degree.
Absolutely. Well, actually, I first went to school for psychology. And so I have a bachelor's in psychology, and not everybody should follow my way of doing it. But then I found out that to really work as a psychologist, you would have to go back and get the doctorate. I was over school back then. I was like, I'm gonna get this degree. I'm gonna get back to Houston and I'm gonna start working. I'm gonna do something. I'm gonna figure something out. So then I got a job, graduated with a psychology degree. Then I got a job at Methodist Hospital. And at that point, right before that, I decided I wanted to go back to nursing school. So I went back to nursing school. I worked med-surg predominantly, probably for about 11 to 12 years or so, and decided I had to go even further because I didn't really want to work bedside for my entire career. So I went back to school. And because I was always interested in the mind and the brain, and I did see a gap for people of color with mental health care, and really not just people of color. Mental health care is probably one of the youngest specialty areas in the medical field. And so what I did was decided to go back and kind of merge that psychology degree with my nursing degree. And then I ended up with the advanced practice registered nurse degree, specializing in psychiatry and mental health.
Amazing. And you're such an even keel type of person. You're real fun, real outgoing, love to travel. And it speaks to the personality you have to have and level of care you have to have for people getting into the medical field, period. Speak to that a little bit about those who should be doing this.
Right. I mean, you have to be able to put people first, not the money, and not the title. It's people first, because you also have to realize that, yes, we go to school, we learn about science, we learn about chemistry, we learn about medications, but it's still a person. It's still a person with a family that they go home to, or they would like to go home to. It's still a person who has to juggle work, medicine, other medical conditions. So you have to have that empathy and be able to connect with people on a deeper level, just other than just science or another person or another number. I think, with that being said, as a provider, you also have to keep a balance, because as providers, we deal with a lot of different things as well. I mean, I have patients that have, especially over this last, 4 or 5 months, that have been coming in every day. Some are stressed. Some are anxious about, how the polarization of our government right now. And I'm not just a provider. I have thoughts about things, and I have anxieties sometimes about different things that we're dealing with. So as a provider, you also have to be able to compartmentalize some of that stuff as best as possible, so you're not taking that home as well to your family. So it's important to keep a balance, but you do have to see the individual that you're treating as a person first. And you also have to have that balance to make sure that you're taking care of yourself as well.
Yeah, that makes sense. Wow, because that's a lot. You have your own challenges. You're a human being. You have your own challenges. And then I feel like you're listening to people all day with their challenges and trying not to absorb it. Because I know sometimes you can talk to friends and they going through stuff and you feel heavy after you get off the phone. I'm like, oh my goodness, it's not even my situation. I'm hurting.
Yeah. I tell patients oftentimes, I said, this is just a common law, right? Energy is never lost, right? Energy is transferred. And so what you just said, sometimes you can talk to a friend, whether it's something that they're dealing with, they're going through like a legitimate medical or mental health issue. But sometimes it could just be, I'm mad because this person said this and I don't like her. And so sometimes you have to shut that off, because what happens is they dump all that on you. They transfer that energy to you. And when you get off the phone, you feel it. So you feel heavy. And you know what they do? They get off the phone, they feel better. They go on and do what they're going to do for the rest of the evening. So sometimes you have to say, hold on, because energy is never lost. It's only transferred. So you have to set some boundaries for yourself as well.
Yes. And I want to talk about, and that's good advice, because I mean, even if you're not in the mental health field, because I feel like that, overwhelmed
Yeah.
after I talk to people. And I'm like, does somebody think I'm a therapist or something? Everybody wants to call me with their issues. Importantly, I want to talk about suicide, right? We've known it's been a rise in suicides amongst veterans. We know during the last recession, and the recession we're not in now, that they're not calling a recession,
Right.
there have been high suicide rates as well. What are some of the signs and symptoms that you can look out for your friends and your family, that
Yeah.
you know that you need to tell them to call 988 or text 988? That's the Suicide and Crisis Lifeline.
Right. Yeah, absolutely. Suicide rates, have increased over the years. Things to look out for is, maybe people like drastic, sometimes it could be drastic changes. Sometimes it could be subtle changes. But people start giving their things away. They start isolating. Their mood. Sometimes you'll see kind of a shift. If they're outgoing or they normally reach out and now they're not reaching out. That could be a telltale sign. Sometimes people make little comments, and I've seen comments on social media, on different social media platforms, where people are, maybe crying out for help. And people may just say it. Fortunately, sometimes I have seen comments where people will get on and respond and say, hey, you can call me right now. And they put their number there to say, hey, call me. I don't know you, but whatever it is, sometimes people may, make comments, thankfully, encouraging the person. But one of the biggest misnomers is if you talk about suicide to someone, or if you ask someone if they're suicidal, that will increase their risk of committing acts of suicide or attempting suicide. And that's one of the biggest myths out there. If you ask somebody about it, sometimes they may say yes, sometimes they may say no. But if they say yes, that's a great opportunity to say, hey, I'm here. Stay on with that person. Text somebody to get some help, or call 988. Whatever you have to do to ensure that that person is safe. But don't be afraid to just come out and say, hey, are you thinking about killing yourself? Have you thought about hurting yourself? If they say no, I won't say it's okay, but they at least know that, hey, this person thinks enough to ask me, so this person has noticed me. This person has noticed something different, so at least they know they're being seen. But don't hesitate to ask. And like you said, there's a new national, thank God, suicide hotline, 988, because the other number was too long. I had to write it down and put it on my desk and put it here. But 988 is simple. It's easy. If for some reason you can't remember it, call 911. You can go to the fire station by your house. You can go to the police station by your house. You can go to the closest emergency center. But whatever you have to do to get help. And just kind of circling back, if someone is suicidal, try to stay on, try to be with that person until you can get that person to a safe space.
Alexis Williams, wow, the time went so fast. This was valuable, timely information. And again, don't be afraid, like Alexis said, to ask and provide the resources. Let people know that you are there for them. And a lot of times people think because you're strong and you've always been resilient that you don't have issues. And that's just not true. Check on your family, check on your friends. Alexis, thank you so much.
You are so welcome. Again, thank you for having me on.
Yes, it was absolutely my pleasure, and I would definitely have you back.
All right.
Look,